friends. I'm Professor Edin Dibuago, a professor of public health medicine, currently discussing cancer of the cervix. But in this episode, we are going to be talking about prevention and treatment of cancer of the cervix. You know, this prevention in public health, we usually group prevention as primary level prevention, secondary level prevention, and tertiary level. So in talking about primary level prevention, we want to talk about those things that we can do to prevent our getting the infection or getting the disease at all. And essentially these things are the things we do to make sure that the modifiable risk factors do not apply, and you do these things by practicing first. You need to practice safe sex. Once you practice safe sex, you prevent infection with human papilloma virus and all the other things that predispose you to having cancer of the cervix. Practicing safe sex means you can abstain if you want. They used to say ABC. You can be faithful to one partner. You don't move around. Then if you must move around, make sure you consistently use condom. That is practicing safe sex. You use condom, not you use today, you don't use tomorrow. In primary prevention, when we are talking about, practicing safer sex, one key aspect of practicing safer sex is also delaying sexual. Delaying this sexual intercourse is a part of abstinence. In fact, that is the first A. When I talked about ABC, the first A, abstinence, talks about also delaying initiation of sexual intercourse. Of course, another primary level prevention talks about, remember we talked about what you eat. Eating healthy diet. Eating healthy diet helps you to put off so many types of cancer. Again, you need to avoid cigarette smoking. These are the things that primarily that can give you cancer. But very key, important primary level preventive method is being vaccinated against human papilloma virus. Like I said, the WHO even recommends that from 9 to 14 years you start. You start this vaccination. And people can take it, even people who are up to 45 years. But if you are up to 45 years of age, you can discontinue having the vaccine. Remember, we say the peak age of this problem is 25 to 45 years. But if you're 45 years of age, the vaccine for human papilloma virus, you can stop. You might not bother to take it. But then you go on with the screening activity, So that is a primary level of prevention. Then, secondary level of prevention. We said in secondary level of prevention, you make early diagnosis and initiate treatment. And once you do this, you get cured. You prevent you from dying from the cancer or having problems, So that is the second. Now, how do you make this early diagnosis? Classically, you do this by screening. You screen for this. How do you screen? You screen, again, the WHO recommendation is that you start screening from 21 to 25 years of age. And then the screening you do is what they call pap smear. Pap smear is the commonest one. You take a swab from the cervix, go to the lab, check if there are some cervical dysplasia, if there are some abnormal cells that tells you that things are not going on well. You repeat it, and from there you can do further tests to ascertain if there's really a problem. That's pap smear. In addition to the pap smear you do to screen for dysplasia and abnormal cells, you also do human papilloma virus screening. You do it by taking a swab from the cervix, examining, and then find out if there's a human papilloma virus there. If there is, then you do further tests to treat it very well and make sure it doesn't progress to something bad, And then lastly, there's what they call visual inspection with acetic acid. This one is a very simple test. It's affordable. It's commonly done, in resource-constrained areas. It just entails putting white vinegar on the cervix and then observing. Any areas you see that have white patches, they are suspicious areas. If the areas are homogeneous and no white patches, you don't have any problem. So it can be used in primary healthcare centers, in resource-constrained communities to give you an idea whether the fellow can be having cancer of the cervix. So essentially, those are the things you do about that secondary level of prevention. That is early diagnosis. The tertiary level of prevention, the classical thing that is done is to make the person live with the disease. Probably it's heart surgery. Then the person should know that it's possible that she can go on with her life. She can still have sex. She's taught. The doctor essentially will do these things. Teach her how she can enjoy sex. All sex must not be penetrative. These are the things the doctor will do. This tertiary level of prevention is usually done with the healthcare worker. It's not something the patient will do on her own. It must be done with the support of a healthcare provider. How to still go on having sex, have babies if you can. And of course, people who are so bad that eventually they can't make it. That's what we call palliative care. Palliative care is that the doctor again will try to prevent excessive pain, painful deaths for these patients. So this tertiary level of prevention essentially is in the domain of the healthcare provider. My dear friends, let's talk about the treatment of cancer of the cervix. The patient usually is good to discuss treatment with the doctor. Especially, it depends on whether the patient will want to continue to be sexually active, want to have children and all that. Then you will discuss with the doctor and you will arrive at the best treatment option. Classically, there are 4 broad treatment options. The first one is surgery. There are different types of surgery. Surgery can involve removing the whole of the uterus and cervix that is infected. That is hysterectomy. That's another form of this hysterectomy is what they call radical hysterectomy, in which case you go further to remove all the lymph nodes and associated organs with the uterus. It's radical. So again, it depends on the stage of the cancer. Treatment essentially depends on the stage at which the cancer or diagnosis was made. That is surgery. There are other types of surgery. These days they can do laser surgery. There's cryosurgery, they use cold to do it. There's what they call comb biopsy. These are all forms of surgery done for cancer of the cervix. So outside surgery, you can move on to the next one, which is radiation. That's using radiation, to treat the cancer. And when you talk about radiation, there are 2 broad ways you can do that. There's what they call internal radiation, and then there's external. In internal radiation, you put the radioactive material inside, very close to the cervix, where you have the focus of the cancer. And then the radiation tries to kill the cancer cells. Then again, there's external. You can use external beam, direct it to where you have the cancer, and then do that. In all and all, they all have their own side effects and shortcomings. But you will discuss with the doctor and know whether to do internal or external radiation. Outside radiation, the next one you have is chemotherapy. This means using drugs to treat the cancer cells. Of course, we all know, most people know that the effects of chemotherapy is usually, the side effects are usually there, Some are associated with hair loss and all that, but that is a very key. At times you combine chemotherapy and radiotherapy. In treatment too, when you find out that the cancer is so bad, that the prognosis is so bad, you find out that the treatment you're giving is what we call palliative care. You focus your attention, like it's related to that third level of prevention we talked about, trying to ease the patient's pain and all that, counsel the patients, and, do all you can to make sure the patient has a beautiful passage and all that. So these are the broad classes of treatment. But again, we keep saying, my dear friend, our constant message to you, message from the Community Positive Health Attitude Initiative team: nobody needs to die of cancer of the cervix. This disease is curable, beautifully curable. The thing you have to do is to pick it early. Just go to any of the teaching hospitals, any of the tertiary health facilities, even many secondary healthcare facilities, and ask her about human papillomavirus vaccine, so that you take the vaccine and prevent it. Again, do your screening, do your pap smear. It is good. It's recommended that you do this every 3 years. Start from 21 years, between 21 and 25 years, screen, and then make sure you prevent it. The world is beautiful. There are so many things you say can contribute to betterment of the world. We love you so much. Your relatives, they love you too. So please, do the needful and stay alive for us. Do not say like most people say, it's not my portion. Whose portion is it? It can be anybody's portion, But the important thing is that there is solution, there is remedy. Please, do go and get screened. We love you. Thank you so very much.